Hello, and welcome to another episode of PHI, Public Health Impact. I'm Cham Dallas.
And I'm Phaedra Corso. In today's episode, we're going to be talking about some very important topics in public health, Cham, global health and infectious disease. And nowadays, you can't think about one without the other. So I'm really glad we're talking about them in tandem.
Yeah, that's right, Phaedra. Infectious disease alone can be a complex and broad topic, but when you talk about it in terms of global health and transmission, it really becomes expansive.
And so today you're going to get a chance to talk to Dr. Chris Whalen, who is a medical doctor and an epidemiologist.
And Dr. Whalen and his internationally respected team are experts in tuberculosis, or TB, and they've been working to understand how TB is spread in urban environments in Africa. The World Health Organization estimates that over 8.5 million people in 2011 contracted TB, and of those, over 1.4 million of them died, making TB the second largest killer resulting from infectious disease.
So I think it's important to distinguish that we're talking about infectious disease today, not genetic diseases that are passed from parent to child, or chronic diseases, which are those that one might develop as they get older.
The good news is that tuberculosis is curable and easily preventable. Bad news is it's also easily transmitted from person to person through the air.
Well, let's get right to our guests and learn about this life-saving research.
We're now here with Dr. Chris Whalen, who has really an extensive research group here at the University of Georgia and overseas in Uganda. Dr. Whalen, thank you for joining us today. Phaedra and I talked some about tuberculosis, but I would really appreciate if you could help our viewers understand really what's going on with this disease and what it means for the people that become infected with it.
Well, tuberculosis is an infectious disease caused by a bacteria named Mycobacterium tuberculosis. TB can be spread from person to person. It initially causes an infection, and that infection is asymptomatic. And most people live with that asymptomatic infection for most of their lives, but a small proportion of them go on to develop disease. And the disease is a pneumonia, usually, that's characterized by chronic cough, fever, weight loss, and sweats.
So how many people worldwide and in Uganda are currently being infected and affected by this disease?
So worldwide, we think there are about 9 million new cases of tuberculosis a year, and 1.5 to 2 million deaths due to tuberculosis worldwide. And TB is not spread evenly by any means. In the United States and most industrialized countries, we don't see much in the way of tuberculosis. But in Africa, Asia, and parts of South America, tuberculosis remains a significant problem. So in Uganda, we see about 25,000 cases of tuberculosis per year in a population of 33 million.
So we talked about the 1.5 million people that die each year. Let's talk about the others. What does that really mean for the health of a person who's infected?
The asymptomatic infection stage, people can live a perfectly normal life and they're not at all infectious to their family, friends, or neighbors, or partners at work. It's only when they progress to disease that they begin to feel the symptoms of tuberculosis. And in reality, it's a relatively small proportion of asymptomatic infections that progress to disease. We think it's about 10%.
Well, let's talk about the healthcare community and what we're doing about this.
Right, so taking the long view of tuberculosis, we have seen the decline of tuberculosis in most industrialized countries around the world. And that decline in TB has been attributed to all sorts of things: better public health interventions, better health care delivery, standard TB control programs, and the like. But in countries that are less developed, tuberculosis remains a huge challenge, and the systems that are in place just are not able to get on top of the epidemic.
So really, by the time we find them and treat them, the transmission's already occurred.
Indeed, that TB is the disease of tuberculosis. As a person goes from infection to disease, that can take several months to evolve. and people often don't seek health care until they've had their cough for 2 or 3 or 4 months. And in Uganda, there's something called the usual cough or the normal cough. So they'll start to develop it, they'll attribute it to something else, and then they'll finally see a healthcare provider who makes a diagnosis of TB. But they've already infected their family and friends and so on.
So we have a problem between just finding and identifying cases and treating them even, and making the epidemic go away.
Right. And the real trick is trying to understand where you want to put your priorities. Is the priority to find cases and treat them, or is the priority to make the epidemic go away? Now, they're interrelated, but how you place your priorities may be part of why we can't control tuberculosis in much of Africa and parts of Asia.
So in this cutting-edge research team that you're leading about tuberculosis, we're going to go now to one of your collaborators that will show us how we can predict the transmission and how it impacts on severity and how you can intervene to stop it. Dr. Andreas Handel is an assistant professor here in the College of Public Health and an expert in mathematical and computational modeling in infectious disease. Well, the first thing I guess we ought to cover, Dr. Handel, is what is mathematical and computational modeling in infectious disease?
Well, simply put, it's using mathematical equations or computer simulations to study infectious diseases. And so the reason why we want to do that is because often we want to study systems that we can't do experiments on. For instance, if we want to know how some potential new SARS outbreak would occur. Of course, we can't take SARS and introduce it in a population and watch. Or if we wanted to test, for instance, intervention against Ebola, we can't take Ebola and let it spread in populations. So the only thing we can do there is often studied on a computer.
Well, tell us then about reproductive number and how that is a measure of disease transmission. Let's compare it between tuberculosis, measles, and the flu.
Yeah, reproductive number is an important concept that actually came out of this infectious disease modeling literature. And the idea is fairly simple. It is just how many persons does an infected person infect before that person either recovers or dies. So for instance, interesting enough for something like influenza, this reproductive number is relatively low. It's about 2. For something like measles, it's really high. It's close to 20. TB is sort of in between, maybe around 5, 6, 7. It often depends on the situation.
All right, now tell us about the difference between this measure of transmission, reproductive number that we just talked about, and the actual severity of the disease.
Yeah, it's important to understand that these are 2 different concepts. One describes how transmissible a disease is, but it doesn't say anything about how bad it is if you were to get it. So for instance, again, measles is highly transmissible, but it's not as bad as, for instance, getting something like SARS, which has a much lower transmissibility, but if you get it, there's a much higher chance that you die from it.
So we have transmission, we have severity. Let's talk about the timing when the disease actually expresses itself. There's a big difference of that between diseases.
Yes, that's another feature. And again, it's not captured by that reproductive number because this number only says how many persons one person will infect eventually before they recover or die. It doesn't say anything about the timing. So for instance, SARS has a reproductive number of about 3 or 4, as has HIV. So same transmissibility, but of course it happens on a different time scale. For SARS, a person will infect other people within days. For HIV, that can be years. So the timing is another component that's important.
Well, tell us then how this computational and mathematical modeling in disease transmission, infectious disease, how's that used to actually stop disease? How that relates to Dr. Whalen's research in tuberculosis?
Well, for that, again, the concept of the reproductive number is important because if we know that, say, one person infects on average 2 other persons, if we could protect every other person, then this person would on average only affect 1 person, or if we could protect a little bit more than every other person, it would affect less than 1 person and it would stutter to extinction. So that's that idea. We need to get this reproductive number less than 1, and then we can eventually drive something to extinction. And so this is the idea that Dr. Whalen has in his research, that the concept of preventing it on a sort of public health population level. If you can treat every individual TB patient, and that is of course something good to do, but if you want to eradicate it, you have to get this transmission number to less than 1.
So how does the reproductive number, which reflects transmission, and severity and timing, all these factors we've covered, how do we put this together in order to intervene?
Well, that's again where computer models come into play. Once you've measured these quantities, for which you of course need field studies like the ones Dr. Whalen is doing, you can combine them in a computer model, and then you can simulate a artificial population, such as a group in Uganda where he does his work, and then we can test in the computer different intervention strategies and see how well they work and make predictions about what would work well in the field, and then we can go back out in the field and test those.
Well, thank you. This really helps to get a better understanding of the cutting-edge approaches now being employed to stop disease transmission in Africa. Thank you, Doctor. So now that we know how an epidemic is formed, why don't you tell us some now, Dr. Whalen, about tuberculosis control around the world. What's going on right now, and where do we need to be going?
Well, sure. Every country in the world actually has a TB control program, and that program is responsible for identifying and treating cases of tuberculosis in that country. Here in the U.S., the CDC is in charge of our tuberculosis control. Worldwide, the World Health Organization in Geneva actually is the main organizer of TB control programs around the world. But one of the problems with TB control is that it's built on a medical model. It's built on the idea that you find a case and you treat a case. But as we can see, the problem of tuberculosis still persists, especially in Asia and Africa and parts of South America. So we really need to think about new ways of intervening on tuberculosis. And the approach that I've taken is to think about interrupting transmission and building in more prevention to the control of TB. That way, we would prevent the epidemic.
Your conclusion is it's really more feasible, more useful to look at these social networks, okay? But we're not talking about Facebook here.
Right.
What do we talk about when you're going to attack the social network?
I began a study of households in Africa, in Kampala, looking at the factors that lead to transmission from the case who lived in the household to the family members. And that research led to insights about how often transmission occurs in the home, both infection and the development of disease. We understand more about the bacteria itself and how the bacteria survives to be transmitted from one person to another. But even there, we began to realize that the household may not be the primary location for transmission in the community or in a country. It may be that the community represents the largest space, the largest place where TB transmission occurs. So in order for us to move from the household into a vast community, we needed some kind of structure. And we began to use the concept of social networks and how human populations are organized or self-organized into these networks as a way to understand how TB would be transmitted within those networks. So our current research is studying and evaluating and delineating those social networks in a part of Kampala, Uganda, where tuberculosis remains a very severe problem.
So if we're going to be able to actually stop this thing, stop this epidemic, we're going from where we've been in the past, from the individual, going to the household, and now going to the community.
Correct. And the community raises perhaps the greatest challenge because we don't know how to intervene. We don't know where to go to find those cases and to interrupt those cases. There are definitely hotspots of TB transmission, but we can't locate them efficiently. And that's the public health approach. The public health approach would be to go to the hotspots, intervene to reduce the transmission.
So Dr. Whalen, who are your partners on site here in Uganda that you're doing this cutting-edge research with?
I began working with faculty members from Makerere University in Kampala 20 years ago, and they continue to be my collaborators today. As I moved from the medical model to the public health model, I began to develop collaborations with the School of Public Health at Makerere University. And my current research work is with faculty members at Makerere University School of Public Health.
Well, this is a halfway around the world. This is quite some distance away, and how do you get right into these individuals, these households, and in these communities right there in Uganda?
Well, this is really a key role of an epidemiologist. As an epidemiologist, I build teams. I build teams of people who are interested and want to solve important public health problems. And what I do is I partner with 1 or 2 faculty members from Makerere University, and we meet on a regular basis to discuss the scientific agenda, what we want to study. And then they become the leaders of a local team. And they hire field workers, nurses, counselors, etc. And they organize these teams to move through the community in a way to identify the TB cases.
Well, now these researchers that are working with Dr. Whalen are going to join us, and we're going to see how this really works in the research and intervention there in Uganda. So these are the Masters of Public Health students here at the University of Georgia College of Public Health that are the central part of Dr. Whalen's team there in Uganda. We have with us Allan Nkwata, who's a laboratory technician with the group, and Justin Ugwu, who's a physician with the research group with Dr. Whalen. Allan, let me ask you, what makes tuberculosis so difficult to address here in Uganda?
So we are dealing with a problem with TB, but we also have a problem, a huge problem with HIV, and HIV seems to make TB even worse.
So Justin, as a physician, why does HIV make tuberculosis so much worse, or it seems to?
So as we know, HIV suppresses the immune system, and when the immune system is suppressed, the patients are at a tremendously increased risk of tuberculosis, but there's a controversy as to what extent the risk is increased, and that is what we are exactly trying to find out.
So Allan, what are you doing to help resolve, to learn about this controversy about the relationship between HIV and tuberculosis?
We're doing a study on published literature out there on the subject, and we have identified over 600 articles. Of these, we have picked 75 that we are looking at in detail.
So Justin, what have you learned so far in this research from all these papers that you've been looking through?
So we are collecting data on the risk of tuberculosis according to the levels of the immune system. We are also collecting the information on how treatment of HIV itself and the treatment of latent TB infection is affecting this increased risk in HIV patients.
So Allan, how's this going to be useful when you finally you think to your conclusions that you can draw?
This is going to be a tool in the evidence-based approach that is being advocated to help clinicians and physicians in TB prevention and control.
Well, this is a really good example of the cutting-edge research being done in evidence-based research by University of Georgia College of Public Health students in Africa. Well, we're now going to welcome Juliet Sekandi, a physician from Uganda who's in the Doctor of Public Health program here at the University of Georgia. As a matter of fact, she's about to leave very soon to go back to Uganda to do tuberculosis research. Why don't you tell us what is it you're going to do when you go back to Uganda in this important work?
Just a little bit of background, Cham. The work that we do in Uganda is premised on prevention of tuberculosis. And why we're interested in this is that when we look at the global burden of TB, the burden of TB in the developing countries and the burden of TB within Uganda, it is really high, even though there's been a lot of developments in treatment and a lot of advances and discoveries on how we can prevent TB. There's still a very huge burden, and that's why we're interested in prevention. So the work that I do in Uganda is a community-based kind of strategy that we apply in communities, do TB surveys to look for for TB cases that are potentially continuing to transmit. So those are the cases that we're interested in.
Why don't you tell us, what is it like to actually go into these communities, these buildings where disease is being transmitted between them, and how you go about finding those people?
We identify poor populations, highly crowded, go in and work with the community leaders, because this is very important. As long as we are to champion this cause of public health, we need the communities on board. So we go in and work with the community leaders, the health secretaries, and these are lay members of the community who have volunteered to work for the cause of health. So once we identify those, we explain and educate them, sensitize them why it's important to prevent disease, and in this case, TB. We move door to door, identifying who might be a case of TB. And the way we do this is we offer them a survey, questioning them about chronic cough. And chronic cough is really prolonged cough that's been going on for more than 2 weeks. This is a cardinal symptom of tuberculosis. And we find that most people in our communities are not aware. And we have an interesting saying in our community: when people are coughing, they would just say, I have a normal cough, even if they've been coughing for 2 weeks.
So after you evaluate and find individuals of particular interest, then you take sputum samples, you refer them for subsequent medical care.
Yes, so what we do is we actually collect the sputum samples, and these are the samples that we use to check for the TB bacteria. So we take these from them at their doorstep and transport them to the laboratory. And of course, this kind of strategy helps in terms of where access is an issue, access to healthcare systems. So we sort of speed up that process, because if you refer them, then we very early on found out that people would delay, another 1 week trying to find money for transportation and trying to find a healthcare or a person who is going to help them to keep their children. So that all introduces delays and continues the transmission that we are trying to curtail.
Well, after you finish your physician now, after you finish your doctorate in public health here at the University of Georgia, going back to Uganda?
Sure.
Yeah.
And public health is my passion, and I really love to work in this area, just because I trained as a physician and I worked on an individual level with patients. I liked that and I love it up to now. But I realized that public health is yet an extended calling of being a person who fights disease and prevents disease, because you sort of stop the problem before it actually comes to you. So we are trying to even address a bigger problem, because when you prevent, you're going to see fewer and fewer patients. And that has a very important implication. And that's why I'm so passionate about this case detection in the community. We are cutting healthcare costs. In the United States, the biggest problem here is healthcare costs that are driving everything. And that is an issue that I think, for me, is one of the most important drivers for me to be able to want to promote public health.
Well, thank you, Juliet. This is public health in its most definitive and useful form. Thank you very much. Now that we've seen your researchers and your research approach, we understand the problem. How are you going to go about making a difference? What do we really need to do to stop this degree of disease transmission?
Well, what I really want to do, Cham, is change policy regarding TB control. I want to use the public health approach, develop the evidence that blocking transmission and preventing cases is the better way to control tuberculosis worldwide.
Well, this is exciting. This is cutting-edge research in public health.
Well, Phaedra, we've really only touched the surface of the research that's being done here to address this tuberculosis crisis around the world.
And Dr. Whalen and his research team are really doing their part in this research effort. But to end TB worldwide, there's a lot more work that needs to be done.
That's right. As you know, I'm always amazed to see these different aspects of public health working together. Dr. Whalen and his team are an epidemiology research team. But in Uganda, they're affecting health policy and management decisions at the national level, and health promotion and behavior issues in individual homes and in communities.
Yeah, I think it's a great example of what we've talked about in several episodes so far, which is that public health requires a multidisciplinary team. You have epidemiologists who are collecting the data, you have statisticians who are analyzing the data. Those data then get translated to policy making and improving population level health, and it's really a group effort to get this work done.
You know, Phaedra, one of the exciting things about TB research and infectious disease research in general is the ability, the opportunity we have to save millions of lives. If we can just do our research well and work together with others to address these really tough and demanding social and scientific issues.
Yeah, here in the College of Public Health, we are truly proud of our research teams, such as Dr. Whalen's, in their ability to impact population level health.
Well, thank you for joining us for this episode of Public Health Impact, and tune in next time when we look at the opportunities for careers in public health.